A little snow possible tomorrow morning. Good Things Utah just around the corner. Good morning, ladies.
Glenn, how are you today?
I'm great. How are you all?
Oh, first day of spring. Our set is all decorated for spring, so you have to stay tuned to check it out. Also talking about getting healthy on the show today. How to do it? See you in a couple minutes on Good Things.
Good Things Utah. Good things, good things Utah. Where the good things are. Good things Utah. Where the good things are.
And good morning, everybody. Thank you for joining us on Good Things Utah. Happy first day of spring. Coming up next on the show, it's something every single one of us should be thinking about. We should be talking about this. Getting a colonoscopy. Why is this so important, and why should you not be scared? There we are in the video, and here we are right here sitting with Dr. Michael Sossenheimer from Utah Gastroenterology. And this is an important time to talk about colon cancer. It is Colon Cancer Awareness Month here in March. We wanted the doctor to come on the show so all of you out there can stop being afraid of getting a colonoscopy. I got one last summer, so you saw me there in my robe. We're chatting about my results. And I'm not 50 yet, but I had something I was concerned about and thought it was important that I came in. Are enough people doing that?
I think it's a great opportunity, number one, to be here on the show, to make everybody aware how important this topic is. March, as you know, is Colorectal Cancer Screening Awareness Month. Today is actually the Congressional National Call-In Day for this subject. We're going to have a run this Saturday, Buns Up, to make people aware of colon cancer.
I love that they laugh and you have a good time with it. It's the buns, it's Buns Up Run.
I think if the weather would be better, we would be wearing
Get
plastic
your
buns.
checked.
I know, but colon cancer is important. We have made great strides. Colon cancer has dropped 20% in new onset and in mortality, because people like you come in early. The problem with colon cancer is, as you all know, there is really no warning sign. Unless you have advanced symptoms, and often by then it's too late, or not too late, but it's a much bigger struggle to get you cured.
That's the scary part of this.
Correct.
Not the actual
Correct.
test, but the scary part is that if you're not getting it checked, you could have something that's completely preventable if you do get checked.
And it's a very easy test. The worst part, if at all, would be the day prior, having to follow a certain diet, having to do a certain preparation. But the day of the procedure is really easy.
You had me laughing the entire...
Well...
Okay, I wasn't awake the entire time, but if anyone could get you to laugh about having your buns up, you
can.
Well,
we want to make it a pleasant experience. We do know how embarrassing this could be theoretically, although it's a very private exam. You know, we really do look at the screen. We don't really look at the patient in that sense. Everybody is focused on the exam itself. And of course, when you are the patient, you wonder what's going on. You feel embarrassed. You know, I've been a patient. I know what you think. You come to the doctor, and when you show up, you're a little nervous. You don't know what we're going to find. So that's frightening to a certain degree. But the one thing people shouldn't do is run away from that thought process. So if there's a concern, if you have weight loss, if you have bleeding, if you have pain, those issues, you need to get checked out.
All right, let's talk about those again. So bleeding.
Well, if you remember, a long time ago, there was a commercial that showed a very graphic image of a patient with colon cancer, and it was a gentleman golfing because he had no symptoms. But by the time that you get symptoms, if you have rectal bleeding, if you have abdominal pain, if you have unexplained weight loss, certainly if you're anemic, you know, those are signs that really need to be looked at. But in essence, if you don't have any symptoms and you turn 50, you should get looked at.
So 50 is the age?
50 is the age to start. That's really when the numbers go up with regards to colon cancer. If you're younger and you have those issues we mentioned, certainly get looked at. African Americans have a higher risk. They should probably start at 45. Certainly if you have a family history of colon cancer, if your parents, your siblings, your children got colon cancer, you need to start at 40 or 10 years before the index relative, whichever is first. So if your mother had colon cancer at 40, you should be looked at 30. You know, you can't wait.
And once you go and say your results are, you're clean, you're good, how often should you be going to get tested?
For normal people, nothing found, no increased risk factors every 10 years. You know, risk factors, we can't forget if you're a smoker, if you're heavy alcohol consumption, if you're obese, sedentary lifestyle, high meat consumption, all those contribute to the risk of colon cancer. Doesn't mean you'll get colon cancer, but those are at least things to keep in mind. So if you were a heavy smoker, if you're obese, if you eat a poor diet, you know, at least get checked so that we can keep sure that you're healthy.
What I love about Utah Gastroenterology is they make you feel so comfortable. I know this is not something maybe you want to do every Friday. You're thinking, am I doing this? But if you are someone that is 50 and older, if you're someone that is concerned about something, these are the people that make you feel good about it.
We certainly attempt to do so. And since you said it, I do it every Friday.
You do
Therefore, I
this?
won't be on the table.
You're not on the table.
No, I'm not on the table. That is correct.
What are the questions you get asked most often? What are the myths you want to dispel right now?
I think the most important thing is, again, that people should not be afraid of the study itself. By the time that patients come to the office, very often, of course, they have seen their primary care provider. They are referred for the procedure, so we may just meet them at the time of the procedure. But for the most part, we have access to their records, so we know exactly what was done. It's important that they follow up, so it's important that they let the doctor know if they have other concerns. So we don't just look for a polyp, but we'll try to take care of the whole patient. So if you have diarrhea, if you have gas and bloating, if you have abdominal pain, that we don't just do the scope, but that we also then try to find out what else will it take to make you feel good, make you whole again. Goes back to those sugary drinks you mentioned, right?
No.
All that carbonation, all that gas that needs to get through somehow. So it's all connected. So in that setting, we can certainly do better. Patients shouldn't be afraid of coming in. Certainly shouldn't be afraid of the procedure. It's a very safe procedure. You will be asleep, so you don't even feel it. Most patients are very functional right afterwards.
No, in and out like that.
In and out like that, almost.
And
correct.
lucky, good results for me. So
Correct.
thank you, Utah Gastroenterology. If you want more information, we are showing their website right there on the screen. And you can also go to our website and we can link you, but they are utahgastro.com or go to abc4.com and then click on Good Things Utah. We'll have this segment, the link, all that information right there for you. Dr. Sossenheimer and so many other amazing doctors part of that group. So nice to see you. And
Thank
I
you.
like that we're looking like this right now. Face
We
to
did
face.
before too, right?
Face to
We
face,
did before too. Very good.
Thank you
Okay,
for being
thank
here.
you.
Coming up next on the show, everybody, are you getting enough iron in your diet? We're talking about why it's so important for women of all ages.